Do you have abdominal pain? Run and see the doctor, your life may be in danger. Colorectal cancer has a long evolution, and its symptoms may vary depending on the location of the tumor in the large intestine. The most frequent discomforts appear in the advanced stage of the disease. However, these symptoms are not unique to colon cancer and can occur in other pathologies such as hemorrhoids or certain digestive disorders. The specialists recommend to go to the doctor as soon as they appear to facilitate that the diagnosis is realized of suitable form. The most common are 1. Changes in bowel rhythm. Patients who have colon cancer may, in some cases, have diarrhea and, in others, constipation. The second option is common in those people who previously had a normal bowel rhythm. However, the most frequent option is that the patient experiences periods of constipation combined with periods in which he suffers from diarrhea. 2. Blood in the stool. The most frequent symptom of this malignant tumor is that the patient presents blood in the feces. The color of blood can be red or black. The presence of red blood occurs mainly when the person presents tumors of the most distal part of the colon and rectum. In the case of black blood, this color appears because the blood is digested and comes from sections closer to the colon, giving rise to black bundles that are known as melanas. If this symptom is not diagnosed soon and the patient does not receive the appropriate treatment, can aggravate and give rise to the appearance of anemia. In these cases, the patient may suffer from dizziness, tiredness, or the sensation of lacking air, among other symptoms. On the other hand, the patient can detect that their stools change in size and are narrower. This occurs because the bowel is narrowing. If the tumors are located in the distal part of the colon, the patient may also have the feeling that the deposition is not complete and that the evacuation is incomplete. 3. Abdominal pain or discomfort. Abdominal pain and discomfort are very common. This is because the tumor partially obstructs the intestinal tube and produces a pain and a situation similar to that of colic. In some cases, the closure of the tube may become complete and intestinal obstruction occurs. In these situations, it is necessary for the patient to receive urgent surgical medical attention. 4. Loss of weight without apparent cause, loss of appetite and constant tiredness. Like other stomach-related diseases, colon cancer, especially when it is in an advanced state, has these symptoms. I ask,